Hello, this is Uri Gutfreund from Singer Nelson Chalmers, and today we're going to talk about health insurance terms explained. These are the basic 6 terms. Number 1, deductibles. The deductible is a set dollar amount that a person must pay before insurance coverage for medical expenses can begin. They're usually charged on a calendar year basis, but may also be on a plan year basis. Number 2, coinsurance. Coinsurance is the money that an individual is required to pay after deductible has been paid. It is often a specified percentage of the charges. For example, if the employee pays 20% of the charges while the health plan pays 80%. Number 3, copayment. A copayment is an arrangement where an individual pays a specified amount for various healthcare services, and the health plan or insurance company pays the remainder. The individual must usually pay his or her share when services are rendered. The concept is similar to coinsurance, except that copayments are usually a set dollar amount, such as $20 per office visit, rather than a percentage of the charges. Number 4, in-network. In-network typically refers to physicians, hospitals, or other healthcare providers who contract with the insurance plan, usually an HMO or a PPO, to provide services to its members. Coverages for services received from an in-network provider will typically be greater than for services received from out-of-network providers, depending on the plan. Number 5, out-of-network. Out-of-network typically refers to physicians, hospitals, or other healthcare providers who do not contract with the insurance plan, usually an HMO or a PPO, to provide services to its members. So depending upon the insurance plan, expenses incurred for services provided by out-of-network providers might not be covered, or coverage may be less than for in-network providers. 6, out-of-pocket maximum. The out-of-pocket maximum is the total amount each year by the member for the deductible and coinsurance. After reaching the out-of-pocket maximum, the plan pays 100% of the allowable charges for covered services the rest of that year. This has been Uri Gutfreund from Singer Nelson Chalmers.
President Aquino signed a law that will provide mandatory health care for all Filipinos. On ANC, a PhilHealth official explained how we'll benefit from this new law.
All Filipinos will soon be able to avail of healthcare benefits under a national insurance program. This after President Aquino signed Republic Act 10606, or the National Health Insurance Act of 2013. It makes a national health insurance program compulsory in all provinces, cities, and municipalities. The new law, which amends the law on PhilHealth, expands health insurance coverage to other sectors including the poorest of the poor, abandoned children, and persons with disabilities. PhilHealth Vice President for Corporate Affairs and spokesperson Greg Luloda says the IIR will identify the mechanism to help determine qualified indigent beneficiaries.
Right now, PhilHealth is doing something by enrolling the poor at the point of service. Right there and there in the hospital, a social welfare officer of the hospital will determine whether you are poor or not. So once you pass that you are a poor, automatically you are a member of PhilHealth, and all expenses will be paid, especially when you go to a government hospital. The DSW, the challenge now is really how to make the means test really felt by the people that they are considered poor. The end goal is really to cover all Filipinos, providing financial risk protection na dapat pag nagkasakit hindi na inaalala ang gastusin.
Under the law, the national government will subsidize the premium PhilHealth contributions of the poorest of the poor, estimated at 2,400 pesos a year per family. He says the government has allotted the budget of 13.5 billion pesos to cover 5.2 million indigent households. PhilHealth is also introducing a no-balance billing for an estimated 10.2 million poor families.
Once you are an indigent member going to a government hospital, you will be treated. There would be no balance billing, no payout coming from the member. Even pregnant women who are not yet enrolled, and once they give birth, automatically they will be accorded a PhilHealth benefits.
all PhilHealth members, including indigent families, will be entitled to the same primary care benefits, benefits covered by 23 medical and surgical cases, with 8 more packages for Z benefits for cases like cancer, diseases, and kidney transplant in enlisted hospitals. Ruliode says they are tapping community health teams to help spread the word on Filipinos' rights to PhilHealth benefits. Meantime, PhilHealth coverage of household helpers is also mandated under the Kasambahay law. Employers are required to enroll their household helpers through Pag-ibig, SSS, and PhilHealth. A one-stop shop for PhilHealth concerns will be operational at these agencies beginning July. Caroline Howard, ABS-CBN News.